Horizontal Clitoral Hood Piercings. Pros, cons, advantages, disadvantages by a piercer. Coming up next in episode number 28. So stick around. Those that are new to the channel, first off, welcome to the channel. But you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I'm the owner and operator of the Axiom Body Piercing Studio located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So when I talk to you about these things, I'm talking to you at a level of expertise as somebody that has been doing this piercing for quite a number of years and has helped a number of clients heal through the process. Before we get into this too far, I do want to do a little bit of a disclaimer. I'm going to be talking about horizontal clitoral hood piercings. They are a female genital piercing. If you're easily offended by anything that has to do with the genitals or piercing or the combination of the two or female anatomy, then this isn't the video for you. If you are not of an age where it would be appropriate for you to watch this, please find something else to watch. If you're looking for any type of sexual gratification or what have you, to make all your bits tingle or whatever your thing is, this is not the video for you. This is solely for educational purposes, for those that are considering getting this piercing done by a professional, not at home, but by a professional, and want more information about it, or possibly their partner, or somebody that's just curious about this particular piercing. So, with that out of the way, let's start in. What exactly is a horizontal clitoral hood piercing? What we're going to pierce, or what we do pierce, is the fold of tissue that lays over the top of the clitoris. With horizontal, we do it horizontally. Vertical, which I've already covered. If you're interested in that, go back a couple of videos because there's some that I've already done one on that, is done straight through that tissue. Horizontal is done kind of at the top of it, with the jewelry hanging down, usually circular, and we'll get more into that later. Now, we're going to go through the pros, and then we're going to go through the advantage or the disadvantages, the cons. I keep screwing that up. I did that a couple videos ago. It's like, now let's start the pros, and went into all the negativity. So we're going to start off with the pros, the advantages. I'm going to give you 5 of them. First one is it can increase sensitivity or sensation, sexual pleasure in the area. That always comes with an asterisk because, as I always say, it can make it better, possibly. It's not going to make it worse, but it's definitely going to make it different. With this piercing, it is relying on having that jewelry laying against the clitoris, so you may have to experiment with different types and styles of jewelry and shapes to figure out what works best for you. It is not a 100% deal, but it will add something to it usually. Number 2, this piercing has a long history of healing without issue and fairly easily. This piercing dates back to the 1990s. It is not a new piercing. It's not experimental. There are a lot of people that have had this piercing over the years. Number 3, it's an easy heal. Not prone to infection. There's a lot of blood traffic in the area. It heals very, very quickly, usually without issue or problem. Number 4, doesn't really affect lifestyle as much as other piercings. Unlike a facial piercing and an ear piercing, where it may greatly affect sleep and etc., this piercing doesn't do that. It also is not going to affect employment, and we'll get into a little bit more about that. Number 5, this is a piercing that if you have it, no one but your own partners and those that you want to know it needs to know that you have this piercing. It's easy to hide under clothing, other than possibly the gym shower room or something like that. No one's going to ever know you have this piercing. So that takes care of the advantages. Let's go on to the disadvantages. Number 1, you very much need a specific anatomy for this piercing. Female genitalia tends to kind of come in a variety of lot of different shapes and sizes, a lot of diversity there, but it's kind of, we divide it into 2 parts. Hills, where the genitalia is more outside the body, in valleys where it's more inside the body. Everybody's kind of in between those two at some level. This piercing does best with those that have the hill style genitalia. The reason being is that with the valleys, if we have to get deep in there and try to fit it in, and you have a ring there, it's going to twist and put a lot of pressure on the ring side to side. So there's not really any room for it. So this is a very anatomy specific piercing. And it's something that you should talk to your piercer about before getting it done. And they should check it before they even get into the process of doing the piercing. Number 2, you are more acceptable to STDs even after this piercing heals. You need to practice safe sex the way you're supposed to, which is every time you switch partners, practice safe sex. Latex barriers. Until you're both cleared and tested. With genital piercings, because you have a hard metal object in an area of soft tissue during sexual activity, because sometimes it can be a little bit rough, it can put pressure on it and possibly cause slight tears. Then you have an exchange of a virus, and the next thing you know, you have an STD. So be safe. Even if you don't have a genital piercing, you should be safe for all of us. And we're all counting on you. Number 3, like all genital piercings, it can lose its newness over time. Some people will talk about how when they first got it, it was like the most incredible thing they've ever experienced. And then over time, it just doesn't seem that exciting anymore. What a lot of that has to do with is the newness of the sensation, the newness of the piercing, the mental side of it too. And as that kind of goes away, it tends to be kind of commonplace. So it's not going to be as exciting as it was. I've had other clients that say that they still love it 10, 15 years afterwards. Everybody's different. And always remember, your mind is your biggest sexual muscle. Number 4, some people can find this piercing uncomfortable. There are certain people that having that sensation or having something against that sensitive area can cause discomfort. So that's something you do want to consider going in. It's pretty rare, but occasionally it happens. This piercing, if you're worried about that, a horizontal is going to have less contact than a vertical piercing. So if you're concerned about that or overly sensitive in that area, you might want to try the horizontal just because it's going to be less contact. Number 5, can bleed off and on anywhere from 1 to 5 days. It varies from person to person. Everybody is different. During that time, I'm going to suggest that you wear a pad or sanitary napkin, not only because it's going to cut down the amount of blood in the area or staining clothing, but it's going to cut down the amount of moisture in the area, which cuts down the amount of bacteria that's in the area when you're most susceptible to infection. And it also adds a little bit of cushioning while it's going through that initial tender phase. Now that we've gone through all of that and we've covered most of what that involves, a couple things that kind of an additional thing that people generally ask about. This is not going to affect walking. Everybody thinks that it's going to, but it doesn't. If you think about where this piercing is located at, you're not going to have that much contact with your thighs or anything else. When we mark piercings, sometimes if we're really concerned about it, I'll have the client stand up just to make sure. If you're really concerned about it, ask your piercer when they're marking. Now let's get on to the consultation. What I would normally go through if you came into my studio and said, hey, I want this piercing. First thing I'm going to tell you is they usually heal out in about 6 to 8 weeks. But I suggest treating it like a healing piercing, especially if you're sexually active, for a minimum of 3 months. Meaning that twice daily, I'm going to suggest doing hot soaks of warm water and sea salt or applying a sterile saline spray and then rinsing. Once a day, I'm going to suggest cleaning the area with an antimicrobial or germicidal soap and then urinating immediately afterwards. Cross-contamination prevention, common sense stuff. Wash your hands before you handle it. Try to handle it by the end or ball whenever possible. The only time you really need to have any contact with the piercing is while you're cleaning it. Rest of the time, leave it alone. Also, keep everybody else's germy little fingers away from it. Understand that microorganisms like bacteria and other pathogens do move on the surface of your skin. So anytime you touch the area, wash your hands before you do it. At some point in your life, you might have been told to spin, rotate jewelry. There's absolutely no reason to do that. In fact, it will increase the likelihood of infection and possibly prolong healing. No oral contact or exchanging of bodily fluids on near around the piercing for a minimum of 6 months. Now, that doesn't mean you can't have sex for 6 months. That just means that you need to use some type of latex barrier, whether it be a condom or a dental dam or etc. We're not concerned about, at this point, as much STDs as we're concerned about the exchange of bacteria and getting an infection because the piercing is an open wound, and that's always a possibility. So, also, I would suggest not using any type of lubricant, condoms, etc., that have any type of warming gels, activation, spermicide. I would only suggest water-based lubricants if you do use any type of lubricants. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with this piercing, you need to clean on a regular basis. Keep pets away from it. Don't let them sleep in the bed with you. Do not submerge piercing in bodies of water you can't control the quality of, which is pretty much everything but your own clean bathtub. Absolutely no swimming until the piercing is healed. Additionally, as I mentioned earlier, they do bleed off and on from anywhere from 1 to 5 days, so I'm going to suggest wearing a pad for at least the first week for the reasons that I mentioned earlier. Sex whenever you're comfortable, of course, gentle at first. If it hurts to do something, try doing something else. Additionally, if you are involved in any type of activities where there's direct contact with the piercing, it's a good idea to cut off on that activity for a while. What I would mainly be concerned about things like motocross, motorcycles, bicycles, horseback riding, anything where there's a lot of pressure in the area and a lot of jostling around. Give it some time to heal and you'll be fine doing all those activities. A lot of people ask about the pain situation. Usually, like most genitalia, it's kind of an intense little pinch initially. Then, unlike other piercings where you might have that throbbing and aching for a couple 20, 30 minutes sometimes afterwards, with genital piercings, like, oh God, that hurts, and then it's over. Other than that, I think that pretty much covers what I would generally tell you if you came in and asked for a horizontal clitoral hood piercing. If you feel like I've missed something, or you feel like I could expand on something further, or maybe I just triggered a question, leave a comment. I usually answer the comments when I have time. I'm happy to share my knowledge with you, or at least point you in the direction where you might find some more. If you like the video, the other thing is make a comment if you have this piercing. Tell other people what you felt like the experience was, etc. We're all about sharing information here and building a community where we openly share information. If you liked the video, give me a thumbs up. Let me know that you liked it. That's like applauding. Everybody loves that. If you haven't already, subscribe, hit that notification bell to ensure that you're notified every single time we post a new video. Right now, we post roughly 5 videos a week, including this series, Pros and Cons by a Piercer, Body Piercing Basics, our studio update, which has tattoos of the week from the 2 artists from the Skin Kitchen, Jack Lowe and Wesley Dickerson, and also Q&A in the Kitchen, which is a panel discussion covering body art, basically, and body modification, where we take a question or topic and talk about it at length. That's also a podcast. And we just launched a new one called Pros and Cons by a Tattoo Artist. That's basically structured the same way this, a little bit different, with Wesley and Jack. So, if you don't want to miss any of that, you better subscribe. Also, if you like this, do me a favor, go over to our merch store, see if there's something pretty or something stylish that you would like to wear and obtain, and buy something. That not only makes you look cool, but it tells us that you like what we're doing and you want us to continue and you like supporting us. It's kind of like tipping in a way. Other than that, have a good day. Hope all your piercings heal with ease and without issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future.